In an age where many people equate success and power with a youthful appearance, some people will go to any extreme to rid themselves of wrinkles.
And now there's a quicker and, in some cases, cheaper alternative to costly plastic surgery. The use of Botox has increased dramatically in just the last 6 months. Botox is actually a toxin. It's a form of botulism. The FDA still has not approved it for cosmetic procedure, but that approval could come any day now. But it is approved for the treatment of muscle spasms, and it's also used to help cerebral palsy patients walk again.
The fact that Botox isn't FDA approved isn't scaring people off. And pictures like these can be very convincing. These are before and after shots of a woman who had Botox treatments to remove the crow's feet around her eyes. And here are before and after pictures of a woman who wanted to get rid of the lines on her forehead.
Now, by showing this procedure live, we are not endorsing it. We just want to give you the chance to see this popular procedure so you can decide for yourself whether it's right for you.
And we would now like to introduce you to Dr. Charles Crutchfield. He's a dermatologist in Eagan. He is joining us tonight and will be doing this procedure live for us. Can you hear us, Dr. Crutchfield?
Yes, I can. Dr. Crutchfield here, and I'm here with my patient, Jan, who's going to be undergoing the procedure this evening.
All right. Well, we want to welcome you both to the show. Thank you for joining us. And we also want to warn you at home, if you're squeamish about needles, you might want to look away for a few seconds. And I understand it only takes about 30 seconds. We'll get to that in a minute. But first, Dr. Crutchfield, how can you perform this procedure if it's not approved by the FDA?
Well, I think it's important to realize that with medicines, the FDA regulates the medicines, but it doesn't regulate the practice of medicine by physicians. Physicians can use any medicines they deem appropriate on their patients for the benefit of their patients.
Doctor, go ahead and start the procedure.
Okay.
I'll just ask you a few questions as we go. First question that most people want to ask is, how long will this last? How long will it keep the wrinkles away?
Well, generally speaking, it lasts anywhere from 1 to 12 months. Here we go. With the average being about 4 months. Some people can get a lasting effect, like I said, up to 12 months.
Oh, Jan, I don't know if you can hear me. Does that hurt?
I can hear you. Oh, it's a little prick and a pop.
Prick and a...
Just a tiny sting.
Tiny sting, I imagine. It looks like it stings.
All done.
What's the ideal age, if there is one, Dr. Crutchfield, for getting the procedure done?
You're all set. The ideal age, I've treated patients as young as 21 and as old as 84. So there's really not an ideal age. It just depends on how well they respond to the treatment.
And is everybody that fast?
Pardon me?
Is every procedure that quick?
That's about it.
Now, Trish is going to have her brow injected, correct?
Yes.
And while you're doing that, let me just ask you, how does it work? We mentioned botulism. It sounds kind of scary.
It does sound kind of scary. I think it's important to realize, even though it's got the name toxin, the Botox itself is really just an enzyme. And any medicine or enzyme used in abnormal proportions can be toxic. In fact, Tylenol, taken at high doses, can be toxic.
All right. But now it looks quick. We saw some before and after pictures. It's going to take about a week for these ladies to see the results, so we'll update everybody in a week.
Correct. In fact, I think I was told they're going to put it on your website, and you can link to it, and we'll have pictures for them.
Yeah.
But what I'm wondering is, it's about, what, $200 to $400 per area on the face that you have injected?
Correct.
And it lasts approximately 4 months, correct? Now, how many times can you come back and do this? I would imagine it's kind of depressing to have it done, have fabulous results, and then suddenly the results go away.
Yeah. Well, I think it's important. There's two ways you can do it. Proactively before a big event. We have a lot of people to do that just once or twice every 2 or 3 years. And some people do it every 2 or 3 times a year to maintain a wrinkle-free state.
Now, we notice there's a little blood there. She's holding the cotton swab on there.
Yeah,
Trish, let me ask you,
that tight there just for a second.
How does it feel for you?
I'm relieved because my headache will now go away.
That's another funny thing you see. Some patients who suffer from migraines also get relief when they have Botox injections.
Let me just close here with this first part. We've said it's become very popular. You have seen an incredible increase in patients at your clinic as well?
Yes, I have. It's grown exponentially, especially over the last year. It's been in the press. A lot of people are concerned about it. They say it's a little bit cost prohibitive, but once again, it's not for everybody. If you're pregnant, if you're nursing, if you have neurologic disease, or if you have an allergy to egg proteins, it should not be used in those patients.
All right. Well, doctor, we're going to check back in with you in a bit, as well as your 2 patients, to see how it's coming along.
Thank you.
Thank you, Jan and Trish. And Dr. Crutchfield, we'll see you in a few minutes.
What we're going to do later in the newscast is update you on the patients, as we said. Plus, we'll learn about the possible side effects of the procedure, and we'll find out who should not have Botox injections.
Earlier, we showed you live Botox procedures, but we stress they're not for everybody.
Dr. Charles Crutchfield, who performed the procedures, told us earlier this evening that possible side effects include bruising at the area of injection, eyelid drooping, in the event that a lot of Botox is used. And finally, some patients might experience an allergic reaction, particularly people allergic to eggs. And doctor, the first question then would be, why is that? Why is the egg allergic reaction an issue with this?
A good question. It comes packed in an albumin protein to stabilize it, so if you have an allergy to eggs, you can get a reaction at the site, similar to patients that can't take certain vaccines.
All right. Now, what does it look like right after you have it done? We saw there was a little bit of blood, but will there be bruising or...
I see bruising in about 5% of cases. Sometimes eyelid droop about 3% of cases. And
eyelid droop, you said? I'm sorry to interrupt.
The eyelids can droop a little bit. That's probably in about 3 in 100 cases.
And that's temporary, I think we...
Usually goes away in 1 to 3 weeks if it happens.
Right. Insurance does not cover this procedure, correct?
Nope. It's all considered cosmetic out of pocket.
Now, we learned earlier that the patients need to stay stationary for, what, 4 hours after a procedure like this? Is that right?
No, not necessarily. They just need to refrain from laying down for a couple hours after the procedure.
And the reason for that is so that it doesn't pool somewhere else in the muscle?
Exactly.
And you mentioned earlier some people who are not good candidates, obviously people with an allergy to eggs.
Patients who are pregnant, nursing, or if you have a neurologic disorder.
All right. Well, now these ladies will go home, and in about a week, what can they expect?
Oh, there they are.
Yep, here they are. Generally speaking, if you go around the eyes, you'll see disappearance of the wrinkles in 3 to 7 days, and between the eyebrows, disappearance of wrinkles in 1 to 2 weeks.
Well, we think you're beautiful just the way you are, ladies.
They certainly are.
How you feel pretty good right now?
Yes, completely fine.
We were told we could ask your ages, but you know what? I'm not going to do that.
Okay.
My mother taught me that that's not the right thing.
Suffice it to say, you look fabulous. We'll check back in a week.
Sounds good.
Thank you so much, everybody.
Check our website for their progress as well.
That's right.
Have a great night. Send you off to bed with that one. We'll see you tomorrow.